Hello everyone, I'm Talha Badar, hematologist oncologist at Mayo Clinic, Florida. I'll be talking about Quantum First, randomized double-blind placebo-controlled phase 3 trial evaluating the efficacy of quizartinib in combination with 3+7 chemotherapy in AML patients with FLT3-ITD mutation. So total of around 3,500 patients were screened between September 2016 and August 2019, and among them 539 were eligible to be randomized. Even in quizartinib as well as placebo arm, in the intervention arm, patients received quizartinib from day 8 for 14 days of induction at a dose of 40 milligram daily, and similarly in consolidation phases. As in the maintenance phase, the drug was allowed to be taken for 3 years from the time of initiation of maintenance therapy. Patients who were on strong CYP3A4 inhibitor, like antifungals, azoles, the dose was reduced by 50%. These are some of the baseline characteristics. The median age was 56 years, ranging from 20 to 75 years. Patients who progressed post-HMA or had a therapeutic AML were excluded from this trial. Around 7 and 10% of patients with quizartinib and placebo arm had unfavorable risk disease. The primary endpoint was overall survival. The median overall survival was around 31.9 months in the quizartinib arm compared to 15.1 months in the placebo arm. In subgroup analysis, overall survival was longer among patients who were less than 60 years of age compared to those with more than 60 years of age with favorable hazard ratio. The secondary outcome of this trial was event-free survival, which is by defined as US FDA AML guidelines not having achieved complete remission by day 42 of induction. This endpoint was not met with a hazard ratio of 0.92 and p-value of 0.24. However, in subgroup analysis, looking for composite CR at the end of day 56 favored quizartinib compared to placebo. Duration response were longer with the quizartinib arm than placebo, as you can see, 38.6 months versus 12.4 months. As far as the adverse events are concerned, the grade 3, grade 4 adverse events seen in more than 10% of patients were febrile neutropenia, hypokalemia, and pneumonia in both groups. Neutropenia was more commonly seen in the quizartinib arm. In terms of QTc prolongation, the QTc prolongation were manageable in the most cases, were common in the intervention arm. Median time to ANC recovery was around 36 days compared to 27 days with the placebo arm, and median time for platelet recovery was around 31 days compared to 29 days in the placebo arm. So in conclusion, its randomized controlled trial showed improved overall survival with addition of quizartinib to 3+7 chemotherapy among patients with FLT3-ITD mutated AML. The impact of allogeneic stem cell transplant in improving overall survival has not been reported in this pivotal study. It will be reported separately. The event-free survival as per US FDA AML guidance was not significant, most likely the myelosuppressive effect of the quizartinib. Quizartinib has shown to improve molecular MRD. That is something which incorporated in this clinical trial, which is unique to this trial. However, the effect of molecular MRD on the outcome has not been reported and probably would be reported in an upcoming publication. So impact on clinical practice, I think the addition of another potent FLT3 inhibitor in our treatment is well welcomed, and we are all excited to have another FLT3 inhibitor to be used for patients with 3-RTD mutated AML. Few things I would like to mention compared to Ratify trial. Patients was older in this trial. The upper limit in the Ratify trial was around 59 years compared to this, in which patients close to up to 75 years age were included. And having patients at an early age group, you tends to have more adverse risk disease phenotype. However, in the subset analysis, they've seen that patients younger than 60 years of age had a more beneficial impact compared to those who more than 60 years of age. The trial does not include FLT3 TKD mutated AML, since this is more selective in FLT3 inhibitor targeting only FLT3 ITD, which is different than the previous trial. With this, I would like to thank you for listening to this brief presentation. I hope you like it. Thank you.